So now we're getting to the fun stuff. We're getting to the dipping of the dipsticks. In the hematology drawers, you should all find a pack of these multi-sticks. Unless we specifically say to use a different type of sticks, we're going to be using the multi-sticks 10SGs. There is one lab that we pull out a different type of stick, but we'll get to that at that point. Pretty much they all get used the same way though. So I've already got my name and my color and clarity on my paper. Make sure I've got the right name and the right urine. I'm going to open this up. I'm going to pull one strip out very quickly, and I'm going to close this up. So you can see there's a bunch in there, and there's actually a desiccant in there to keep the moisture out. So we want to make sure to always keep the lids on these to make sure we don't get moisture that's going to ruin the strips. So I got a strip out that's ready to go. I also have here one of the orange bio squares that's sitting out. So what I'm going to do is I'm going to give my urine a swirl. The reason we always want to make sure to give it a swirl is there could be possibly some cellular debris that we're looking for, red cells or white cells that are sitting on the bottom. So we always want to make sure that they're fully mixed up before we actually dip it. So I'm going to take my dipstick. Now there's not a ton in here. I'm just going to roll it to its side. I'm going to push this in, give it a little swirl. I'm going to drag it out the side of the cup, and then I'm just going to blot it. I'm not going to blot, pad down. I'm just blotting to make sure that the moisture that's collected between the pads are actually empty. We don't want big puddles in the middle of the pads. So now what we have to do is wait we have to measure it all per the time on the canister. The first time you do this, you're not going to hit it all in the right amount of times. That's okay. You'll get better throughout the time and you'll get faster. So we're going to start. It starts on the bottom. We roll it up. See that where it says down here ID band? That's the little clear one. That's where your handle goes. So what we do is we take the urine and we go back left and right till we find the colors it's most between. So you can see how dark this is. So it's 2,000 or more. So over on my paper, I'm going to write greater than or equal to 2,000 milligrams per deciliter. Bilirubin, it's negative because it's less than the negative. So it's going to be negative. You can see I read one and write one. My ketones, you can see there how it's not getting any peaker or brighter, so it's negative also. Specific gravity. So now we got to kind of make some decisions, right? So I'm going to hold it between the two that it's closest to, and I think it's closest to 1.005. So I'm going to put 1.005 right there. Specific gravity gets no units. Next one is blood. See how it's negative? It doesn't have any speckles or any greens in it, so that's going to be negative. Blood is negative. Now early on, I have two different spots. One that's for blood and one that's hemolysis. Because if you look at our strips, I got some here. These first couple are speckled. Those are blood cells that have hit the pad and bursts. Versus already hemolyzed blood, where you're going to get something along these lines where it's darker. pH. Oh, my pH is pretty low. It's a 5.0. And again, pH doesn't get any units. Protein is negative because you can see if I even go to trace, it's not there. So it's going to be negative. Urobilinogen is, see how it's like way down here on this side? You are never going to say negative because the lowest we can possibly read is 0.2. So you can do less than 0.2. And the units for urobilinogen are milligrams per deciliter. Or you can just do 0.2. I'm okay if you just do 0.2. So it's less than normal. Then up here, I'm to my nitrites. My nitrites are negative. There's no color there, so they're negative. And my leukocytes are also negative. So I'm going to put that right there also, negative. So when you are done with your strips, set the strips off to the side, and the strips that you're done with, like when you're testing, just set them all in the back corner of your placemat. And what will happen is you'll just collect them all, and at the end of the day, you'll wrap them in paper and throw them away. These are not considered biohazardous. They're not drippable, pourable, or flakeable. And there's no obvious signs of blood in any of them. So you can just set them in the back, and when you're done, you pick up your paper, and you just pitch the whole thing away.